Hello, a very good evening, ladies and gentlemen, especially to all of my dental colleagues out there. As you all know, my name is Dr. Tuba, and my main aim through this channel is to guide all the medical professionals, especially the dentists who would like to consider Denmark or other foreign countries as options to work in. So today I'm going to talk about a country that, to be honest, was not really on my radar, but I was talking to a colleague who works there, and in conversation, we were talking about Kuwait basically. And in that conversation, when I was asking about the salary and how much he earns and how it works there, he basically told me a certain amount of salary that he earns. And of course, due to confidentiality, I'm not going to mention that here. But to what I thought, it is a lot more than what I thought it could be. And my first question, as an instinct, was so is this the money that you're earning, the salary, is it before tax or after tax? And to that he replied was, taxes, what are you talking about? I'm not in Europe, so we don't give taxes. And I was like, so there are no taxes on this salary, so this means this entire money goes in your pocket? And he's like, yeah, of course, because there are no, we don't pay taxes. So of course, the combination of a very high salary plus no taxes is of course a benefit for all the medical professionals, and especially the dentists who are working there. So to that, I requested him to make a video because definitely that would help. The guidance on how to work in Kuwait as a dentist would definitely help a lot of people, especially who are around the Gulf and Middle Eastern states. So over to him now. And of course, if you guys have any questions, you're most welcome to email me, which my email address and my Insta ID are listed right below this video. So I really hope this video helps, guys. And thank you.
Assalamualaikum everyone, it's Dr. Faisal here. A brief introduction about myself. I'm currently working in one of an elite practice in Kuwait as a consultant periodontist and implantologist. At the same time, I am working as an assistant professor in periodontology department of Kuwait University. Previously, I was heading one of a renowned dental college periodontology department as head of department and assistant professor. So I was requested by Dr. Tuba to talk about the licensing system of Kuwait. So I think we can divide that things in couple of questions. So initially it would be easy for you guys. So if I think most of my listeners or the people out there might be Urdu speaking, so let's talk about betterly in Urdu. Okay, so सबसे पहला question, how to get into Kuwait? The first thing you need to understand that Kuwait at the moment is not really very friendly with the visa processing system. तो आपने सबसे पहले क्या करना है कि make a very nice CV that is very attractive. Put lots of things that you can do, especially veneers and implants, and make sure that you are putting the things that keep you out or above other CVs. Make a nice pattern. There are lots of templates out there that you can use it. So then put those CVs on the net, and I think you can get the most of the links on Google Maps जहाँ आप लोगों को emails मिल जाएंगी बहुत सारे clinics की. Just throw your CVs to the emails of those clinics. Okay. First thing, once you get an approach from the clinic and you get approved by them that with a contract that you will end up this amount of a salary or whatever the procedures will be, तो आपका 50% या 50% to 60% work हो चुका होता है once you get the contract. So after that, once the contract is done, there are a couple of other things that you need to be sure about. Okay, what will be the next procedure once the contract have been achieved? आपने अपनी डिग्री वेरिफिकेशन करवानी है HEC से, देन मिनिस्ट्री ऑफ फॉरेन ऑफिस से. सिमिलरली आप ट्रांसक्रिप्ट्स अटेस्ट होंगे बाय ईदर वट एवर द गवर्निंग बॉडी इज़. MDS अगर आपने किया हुआ है तो यू नीड टू गेट इट आई थिंक वेरीफाइड फ्रॉम UHS, देन हायर एजुकेशन काउंसिल. फिर आपको मिनिस्ट्री ऑफ फॉरेन ऑफिस से सारी अटेस्टेशन वेरिफिकेशन करवा के make up a file of those things and scan them up. They will require your scanned copies. You will send it to your clinical contract manager. What they will do, they will put all the things on the net. The server, they basically have a server to check कि आपकी डिग्रीज वेरीफाइड हैं या नहीं हैं, या आर दे इक्वलेंट टू द स्टैंडर्ड्स ऑफ द कुवैती बोर्ड. मीन टाइम देर इज़ समथिंग कोल्ड डेटा चेक. आपने यू हैव टू अप्लाई देयर, दैट कॉस्ट अराउंड अबाउट 70,000 to 80,000, not exactly sure, but round of that. So they will verify your degrees and they will give you a certificate that your degrees are genuine and equivalent to whatever the status you are applied for. Similarly, I think data flow भी होता है. Don't get confused. Kuwait does not accept data flows. They accept data check. Once you're done with your data check, compile all the things up and scan them up and again forward it to your clinical manager. They will put you towards the licensing system. You will get an approval within a month after you got your contract finalized. Within a month, they will issue you a visit visa. Then you have to fly here in Kuwait and give your exam. Ab exam mein there is a division. Once you get yourself registered as a GP, so आपका एग्ज़ाम थोड़ा मुश्किल हो जाएगा, क्योंकि अब यहाँ GP के लिए बहुत ज़्यादा लोग अप्लाई करते हैं, तो कंपटीशन इज़ रियली हाई. So GP एग्ज़ाम होगा basically 3 stages के अंदर. Once first stage would be your SCQs. There are around about 10 SCQs. Then there are short answers type questions. I think most of the people would be able to do that. Then there are 100 MCQs. Mostly the MCQs are similar to that of the NBD pattern, or I think dental decks follow करें, because यहाँ को अमेरिकन सिस्टम बहुत ज़्यादा पसंद है. ब्रिटिश सिस्टम को ज़्यादा इतना नहीं फॉलो करते हैं. अमेरिकन गाइडलाइंस, दे ऑलवेज प्रेफर अमेरिकन गाइडलाइंस. Then if you clear the MCQs and the SCQs, so then they will have almost 50% of a cap. Once you are going above the 50%, they will put you towards the interview. So once you get into the interview, they will ask you, I'm not sure, about 10 or 15 questions relative to your general practice. उसके बाद वो आपको अप्रूवल आ जाएगी वहाँ से, एंड होपफुली इफ़ यू पास ऑल द स्टेप्स दे विल इशू यू लाइसेंस. दैट वुड बी योर जनरल GP लाइसेंस. सो आफ्टर दैट देन दे हैव अकामा, जो हम यहाँ को PR कह लें. PR तो नहीं है खैर, लेकिन एक रेजिडेंसी लॉन्ग टर्म वीज़ा कह लें, वो आपको वो इशू कर देंगे. दैट वुड बी एनुअली आई थिंक रीन्यूएबल होता है, या वट एवर द कॉन्ट्रैक्ट यू गाइज आर एंडिंग अप इनटू इट. On the other end, once you are a specialist, so आपको शायद chances यही है कि you might not have to go for a written or an MCQs. You will direct end up into a interview state or a viva type of a situation. I can talk about myself because I got straight towards the viva or an interview. Then what they do, उसमें आपको they will show you couple of cases. They will talk about the cases. They might divide it into 2 parts or 3, जिसमें एक पार्ट 100% मेडिकल एमरजेंसीज कवर हो रहा होता है. फिर मेडिकल कॉम्प्रोमाइज पेशेंट्स आपसे पूछे जा रहे होते हैं. फिर दूसरा पार्ट आपकी स्पेसिफिक स्पेशलिटी से आ रहा है, जो आपके केसेस हैं. यू विल टॉक अबाउट योर केसेस. They have specific answers in their heads, but I think most of the people, once they can clear them out. Then third part is your patient management. They might give you a patient and ask you कि patient करें या उसको क्या करेंगे आप, या उसके ऊपर क्या observations हैं आपकी. But preferably they are doing this for the people coming from the Asian community mostly. If you have a British degree, तो वो बहुत थोड़े से, या American degree या European degrees, तो वो थोड़ा सा ज़रा lenient हो जाते हैं. I don't know why, but they do that. So, but if you have an Asian community coming to you from a degree which specifically FCPS है या MDS है, they will scrutinize it thoroughly. Once you're done with that, you can straight away get your specialty exam. But another thing in Kuwait, you have a specialty exam for everything. I did my perio exam, I cleared it. Then I had to appear in my implant exam that have specific requirements that you might have placed 20 implants. उन्हें रिस्टोर किया होना चाहिए, आपके पास डेटा बैंक होना चाहिए उनका. फिर एक रिटन एग्ज़ाम होता है, स्पेशली व्हेन इट कम्स टू द इम्प्लांट्स. बेसिकली इट्स अ प्रेस्टिजियस लाइसेंस कंसिडर्ड हेयर. सो आपका एक रिटन एग्ज़ाम होगा, उसके बाद आपका एक वाइवा होगा और फिर केस सिनेरियो क्वेश्चंस होते हैं. So once you clear that, you get the surgical part. Then I did my second part of restorative part of the implants. तो उसमें basically restoration relative to implants, उसके ऊपर exam, उसके cases और ये चीज़ें होती हैं. So basically आपको, as I can talk about myself, I got my perio exam, I got as a periodontist. Then I got my implant that is divided into two parts, surgical implant and the restorative part. So similarly, you have a licensing for oral surgeons, prosthodontists, and pedodontists, and similarly orthodontists. One thing I think I left it because you need minimum of 3 years of clinical experience after your postgrad degree to apply here as a specialist. Then you need 5 years of clinical practice for as a consultant if they take you as a consultant. Because अब होता ये है कि जब स्पेशली पीपल कमिंग फ्रॉम आवर एशियन कम्युनिटी या MDS वगैरह, तो वो ये प्रेफर करते हैं कि यार उन्हें स्पेशल कैटर पे स्टॉप कर दिया जाए. सो कंसल्टेंट के ऊपर जाने के लिए आपको या तो आपको कोई अमेरिकन डिग्री चाहिए या आपको कोई ब्रिटिश डिग्री चाहिए. वो भी ब्रिटिश डिग्री भी उसके साथ एग्ज़ाम्स होंगे. अगर आप अमेरिकन डिग्री है तो एग्ज़ाम होंगे, लेकिन वो थोड़े से लीनियंट हो जाते हैं. तो ये एक आई थिंक दिस इज़ it's an overall pattern of getting yourself registered in Kuwait. Coming to the, I think people might have this question, not sure Tuba never mentioned that, but I will go through it because most of the people might think how much they are paying you and what is the end of a day gain. Comparatively, it's better, it's really good. If you are comparing Dubai with Kuwait, आपका एक बेस पे होगी और जो भी आपका कॉन्ट्रैक्ट होगा, वट एवर द अमाउंट इज ऑफर टू यू, देन यू विल हैव अ शेयर एट अबव इट. वट देयर इज़ अ बैरियर. लेट्स अज्यूम आपको कहते हैं कि आपको 20% शेयर मिलेगा, तो आप उससे पहले एक बैरियर होगा आपका. लाइक आपने 2000 दिनार या 3000 दिनार बनाने हैं, उसके ऊपर आपको शेयर मिलना शुरू हो जाएगा. लेकिन अगर देखा जाए तो यहाँ जो रेट्स ऑफ प्रैक्टिस हैं वो बहुत हाई हैं, तो इस वजह से डज नॉट मैटर्स. यू कैन ईजिली समबडी हुज कमिंग हियर कैन मेक दैट अमाउंट ऑफ मनी. So I hope I am able to answer all of your questions. I am open to any question relative to the Kuwait itself, or somebody wants to join the Kuwait University, they can have couple of questions, whatever they want. So we can look into